Hi everybody, my name is Lulu Achua. I am gonna be talking about the procedures in providing tracheostomy care. I do not have an actual patient or a stuffed animal with me, so I'm just going to be explaining the process or procedures in which I need to follow to do tracheostomy care if I ever have an actual patient for that. Before I start any skills, I need to confirm the provider order. Then I'll make sure I provide privacy to my patient. I wash my hands, which is hand hygiene. Introduce myself to the patient. I gather my supplies. And then I will also identify the patient with the two forms of identifier, which is by asking them to tell me their first and last name and date of birth. While they do that, I confirm with their name band to make sure I am actually working with the right patient. After that is done, I will assess the patient's oxygen status and check the need for suctioning. I also make sure I position the patient on a comfortable position in a semi-Fowler's position. Then, before starting the procedure, I will put on clean gloves. I turn on the suction unit and adjust it to appropriate pressure, which is no more than 150 mHg for adults. I open a sterile suction package. Then I put on sterile gloves with my dominant hand, which is my right hand. I pick up the catheter, the sterile catheter. I pick up the connecting tubing using the dominant hand. For me, it's the right hand, and connect the tubing and suction catheter. I moisten the catheter by dipping it into the container of sterile saline and check the suction. Now, using my non-dominant hand, which is my left hand for me, I check the oxygenation. I hyper oxygenate the patient for 30 to 60 seconds, and using the dominant hand and maintaining sterility, I insert the suction catheter into the trachea and the trachea airways until resistance, which means until it cannot go anymore. I apply caution while suctioning. I do that slowly. Withdraw the catheter while rotating the catheter in a circular motion, and I make sure the suctioning is not done for not more than 20 seconds. I also rinse the catheter and tubing with normal saline until clear, and I repeat suctioning process again, alternate nostrils until I make sure I do not suction more than 3 times to avoid it from being irritated or bleeding or even get bruised. After the procedure is done, I remove the catheter from the suction and remove my gloves. I perform my hand hygiene by washing my hands. I also make sure I rinse the patient's respiratory status. I reassesses the patient's respiratory status for the effects, the effort, the oxygen saturation, and the lung sound. All this is being done while I maintain the sterile procedure to avoid infection, and then assess the need to provide tracheostomy care after suctioning. So if there is need, after the suctioning, I have to provide care. But if there is no need after that, okay, then it's fine. I open a sterile supply for tracheostomy cleaning if not previously opened. So if there is need for that, then I open another a sterile package. So when all that is done, I finalize everything by removing the soiled gloves, wash my hands, discard all used supply, and then document the procedure. Documentation is very important in everything I do or we do as nurses, because any process that is not documented is considered not done. And if you do not document, the next person will not know what you did and what else they need to do. So somebody might be repeating a procedure which was already done if documentation or proper documentation was not done. So in everything we do as nurses, the first thing that comes to mind is proper documentation after our process is being done. Thank you.